Hi, guys. Denise here with the TOWTalk podcast. What do you think of our new intro? Did it wake you up? Anyway, what follows was supposed to be just a brief announcement. I'm having some issues with my left eye. And what happened is it evolved into a longer conversation regarding healthcare. So since we didn't have an opening to that episode, here it is. Welcome to the show. But before we get started, please make sure to like, share, and subscribe. You can follow us on all the socials. I'll make sure to list them in the summary. And if you could, please leave us a comment. We love to hear from you. All right, so stay tuned, and we got more content coming. Hey, Neil. So, guess what? I have an announcement for those of you who are watching. And it falls in line with our discussion last week. We were talking about healthcare. So I went to my eye doctor yesterday, and in my left eye, I have a freckle. It's just been there my whole life, and it's been basically innocuous my whole life. But what they do is they take those photographs of the inside of your eye, which blinds you for about 10 minutes. But the eye doctor discovered that for the first time, the freckle may be thickening into a possible growth. So, it's just as well that we're talking about healthcare. My coverage, now hopefully my coverage will cover for medical issues with the eye, the routine eye exam I pay for out of pocket. But yeah, this is why we want you to have healthcare. So I don't know what this is going to be. I'm supposed to go to a specialist in 2 weeks. Actually, the doctor's office made the appointment for me. And the first appointment they offered was October 6th. And the doctor's office was like, can you get her in sooner? Which isn't making me feel very confident as to what's going on. But I will be seeing the doctor on the 26th, and they'll be doing further testing into my left eye to see if there's something going on there. So,
does it impact your vision at all? Any issues with your vision or peripheral or anything?
Not that I can tell, but I noticed that it was feeling like my vision was changing a little bit. Turned out it's actually my other eye that changed. So my vision is still good. But I remember years ago when the freckle was found, Dr. Lake had said that if it was to start to thicken, that they can, I guess, do laser and zap it to get rid of it, which I don't know what that does to your vision. I know people have had LASIKs where you're looking at them as they're putting like needles in your eyes. Just that just kind of freaks me out. So yeah, healthcare.
What is sorry, just one
No,
question
go ahead.
before we get into the healthcare thing. But did your doctor tell you what could happen if you don't do anything? Like what the consequences might be? I think, people might want to know, from their own perspective.
I didn't ask. They just said we need to send you to a specialist to have it looked at. Could be nothing, but it's better to play it safe. So I just took that as fuck.
Right.
So yeah, it was.
Now, how much do you generally pay annually for your? And if this is too personal, that's fine. I'm sorry, but what do you normally pay annually for eye care? For
100%. I do not have an eye care plan. I do have a separate dental plan that I got through. Again, I told people that I'm in the ACA plan for New York State of Health, but they didn't have a vision plan for me to go into. So I pay everything up front. So I paid for the exam. They actually, when they found that there was slight changes in the size of the freckle, they had another machine that did almost like a scan of the thickness and took cross sections. They did it for free for me. So that doesn't make me feel much better either. I'm really thinking about it.
I don't understand I don't understand. Like it just boggles my mind. Right. Like I mean, I go back to I just want everybody to have health care. Like how is it that we live in the richest country in the world, right? And this country doesn't believe that your vision has anything to do with your health,
Seriously, like it's the
right?
most important thing. If you can't see, you can't drive. You
Well,
can't.
it's actually it's just even simpler than that. If you have vision problems, right? Like in other words, if you have trouble seeing distances or you have trouble reading, right? It can cause headaches. Headaches are a healthcare issue, right? Like now you're
Yeah,
taking
good point.
drugs for your headache, right? That was caused by your vision problem that you can't get treatment for, right? Because, and then, a lot of people are like, "Oh, well, just go, you can't just go to the pharmacy and say I'm just going to get a pair of reading glasses or I'm going to get because you're putting something on your eyes that's augmenting your vision, right? That could cause other health problems. Like I don't understand how that isn't healthcare, right? Like other countries, it's healthcare. Doesn't matter whether it's your eye, your ear, your teeth or whatever. It's just healthcare, right? Like in the United States, I want to give you vision care and dental care, and now I'm a socialist. Okay, great, thanks.
Yeah,
Like that's just a stupid response. It's a stupid response. Say it. It's a stupid
it is a
response.
stupid response. I mean, we need this. We are the richest country in the world, at least for now. We still are, and there's no reason why we can't offer this, offer health care to people, and offer at least alternative options that can keep the cost. People should not have to, go into debt or take massive mortgages out on their house to pay for, something catastrophic or
What
pay.
happens if it's not covered? What's going to happen if it turns out that it's considered eye care and not health care, and you have to get this expensive laser surgery? I mean, what
I
then?
don't know. I'm probably going to have to reach into my 401k and take out my retirement. That's where I would go. And
And and
that's no
and
bullshit. That's the truth.
and no offense, but that's fucked up.
Yeah.
I'm
Yeah.
sorry, like the fact that there are people in this country who say, "Great, good," right? Like because they don't believe that vision is healthcare, right? Like I don't understand that thought process. I don't understand how you can wish that upon people that they should have to sacrifice their future, right?
Or
For for
retirement.
for
I might
basic
have to work a
for
lot.
basic well it is it's your retirement is your future,
Yeah.
right? For basic healthcare that we should all have,
Yeah.
you know and
Yeah.
it's also interesting you could have gotten and it's funny because you could have gotten that appointment faster in Canada
Yeah.
because it's considered emergent care than you could get that appointment here in the United States, right? Because of the fact that it's really tough to get appointments now. It's really tough to get appointments now
Yeah.
for anything.
For Tell me about it. And if it does, and I'm thinking about the timing of this, right? Because as we spoke about last week, I don't know how the cost of my plan with CDPHP is going to be impacted. How much more I'm going to be paying. It could be several $100s more per month. That's what I'm anticipating. So if it's something that's sort of outside my budget of things, then I'm going to have to, move to another plan. But at this point, I don't think I'll do that. I don't think I'll do that because, so again, what I mean by timing is if this is something that needs to be operated on, I need to do it before the end of the year in order
And
to.
can I don't even know what they are, but an eye surgeon do that, get you in, right? Are they going to
Within
have
that
the
time frame.
availability to get you in during that time frame? I had a similar issue come up. I had a sonogram done at the I think it was the end of July. I had some testing done, They needed to check something out, and they found, I don't know, when they do those things, they find
They
whatever,
find, they always
right?
find something.
Right, and they were like, well, we need to, to be safe, we want to get you an MRI, right? It was 30 days before I could get an MRI.
But we want to be
They were
safe.
like, oh, the earliest we can get you in is like beginning of September, which is like, but it's just like this is the world. It used to be, everybody seems to be referencing decade ago when you called your doctor, you got in the next day.
Yeah.
You were
Hey, I
sick,
think
you got in the next day, right? We don't live in that world anymore. I really want people to understand we do not live in the past anymore. Okay? We have to accept the world as it is now. And that is, you're going to wait. You may wait month, 2 months, 3 months to get an appointment for something, right? Particularly a surgery now. Surgeries apparently are really far out, and they're really tough to get. I recently had a friend who went into the hospital, and the doctor wanted to do the surgery because he was emergency surgery, right? But it was like kind of one of those surgeries where it was like the doctor kind of knew he was going to need it, but he could also be given like a day or two to just like, okay, what are my options type of thing, right? Because he may not like, it maybe some time, and sometimes you need a day or two to think about it, right? Well, the doctor had an opening in his schedule, and he wanted to be like, oh, let me just do it now because I have an opening in my schedule, and in 2 days, if it becomes to the point where you really need this, where it really becomes emergent because it goes the other way, right? I may not have time to do it then, right? Like, I mean, that's the world we've gotten into.
This kind of comes back to our lovely neighbors to the north, Canada, because you guys are doing healthcare right. Um, it always used to be, if you talk to a lot of people who don't really understand about universal health care, they will sit there. Their argument is oh, people wait forever and ever. So, that's not really true. So, for people who get regular appointments, just routine checkups, that kind of thing, yeah, you might wait for that. But if you have something urgent, they'll get you in sooner. And they also have, if you want to, you can pay for these additional riders on top of the free health care that I understand it run about $120, $150 a month US. That will increase your tier level. I guess it's a tier level. So good for seniors who are more likely to need health care. If they got to get into the doctor for whatever reason, they can get in sooner. So it's really not different. In many cases, as we covered last week, with the impacts from cuts, you're going to be waiting. And if you have something like a lump forming, that can mean a lot.
What's interesting, what's interesting is Canada utilizes what's called the triage healthcare system.
Okay.
A lot of people might know what a triage healthcare system is. People don't know what it is. It's basically the more emergent your care needs to be, the sooner you get in.
Okay. So they're okay. Yeah.
It,
Triage,
it, it would
like
be
in the
like
emergency
going.
room.
It would be like going to an emergency room, right? The U.S. healthcare system, unfortunately, has gotten to the point where we used to be sort of that triage system if you could pay, but now it's a tiered triage system, right? So it's the idea that if you are wealthy and you have money and you have great health care, okay, then it doesn't matter what type of healthcare you need, you are going to get it, whether it be emergent or non-emergent, right? You get immediately bumped to the top of the list. Well, if you're getting bumped to the top of the list, everybody else is getting pushed down, right? So
Regardless of level.
your emergent care, right, may be below somebody else's tiered care, right? In other words, you have that upper tier, you have that middle tier, and then you have the bottom tier, and you may be emergent where you should jump all those people, but because you are in that third tier, you're not going to jump anybody. So now all of a sudden you're on that waiting list. That's not a triage system. That's not a good healthcare system. That's really a sick care system. That's just
But
a
that's a crime
you know,
right there.
that right. And that's sort of what the U.S. system has become now, and that's really unfortunate. And I just I think it's horrible that people don't realize that it's a system that's basically eaten itself, and it's being run by insurance companies and bureaucrats up top who just want to make profit, and that's it. I mean, you're just a profit margin now. Now you've become a profit center. So
Wow.
your healthcare is dependent on their profit. That's why I said 3 tiers, right? It's
Yeah.
that 3-tiered system.
The ones that
If
can
you're
make
in
the
that
most
bottom
money.
tier, right? If you're in that bottom tier, you're not making them any money. So they have no interest, no vested interest in treating you.
So much for the Hippocratic Oath is what you're saying.
It has nothing to do with Hippocratic Oath, right? Like, because it's not the doctor making those decisions. I mean,
It's
everything
insurance.
is run everything is run by insurance companies and big corporations now. You look at the healthcare companies around us, they're all multi-billion-dollar corporations. Like and now they have AI like determining your care and where you are going to fall into a system. So when you go to look, oh, when is my appointment, and then somebody else goes to look, and you are on different tiers. You're in, say, tier 2, and they're in tier 3, right? You may get an earlier date than they would get.
Wow. That's actually frightening when you really, because I'm just sitting here thinking about this. That's actually frightening for people. And think of younger people who are working and they have some sort of an injury and they got to determine whether they can go to work and they're sick or injured and
But
they can't get
insurance
in.
companies, have been doing this forever, right? Like they make determinations on surgeries based on your age, on your ability to recover, on your ability to like to take certain medications, to like I mean, they have all these factors that go into determining. So you may need a hip surgery, but your doctor's telling you, well, your insurance company isn't going to cover it. Or your doctor will try to let you off easy, going, you do need the surgery, or you're going to need it at some point in time, but, we should put it off for now because the algorithm may have said in the day they're not going to cover you. Your doctor wants to let you off easy. And, maybe the algorithm turned out and said, well, we could give it to her today, but she's going to be dead in 3 years.
Oh, yeah.
Right? So why are we going to spend that money? Because we're not going to recover anything, because she's in tier 3 or he's in tier 3. Sorry, I
So
didn't mean to say just she, but because it
no,
is.
I
he
know
too,
what you're
but,
saying. No,
like
no,
it's
that's like it's a death cult. It's a
right. This is it. These are. I mean, the funny part is that when we were talking about ACAs, we were talking about death panels. These are death panels. They literally like. This is what they've done. We've created a system of death panels. This is sick care. This is there's no other way to put it. The thing about the ACA that was so optimistic about that made it such an optimistic bill, even though it was garbage, right? Like it made it so optimistic was the idea that wellness care, that you would get you didn't have to pay your copay. It was once a year you could go to the doctor and they could give you a physical. They brought back the annual physical, okay, and that's what made the idea that we can do preventative care, okay, and that went to complete garbage, right? Because one party just didn't like the entire bill because too many people got health care and it slowed down our healthcare system, because they're in the top tier and they didn't like having to share with the bottom tier.
And the funny part is that it created It created jobs. Our hospital system here expanded, and we hired a lot of people, and more medical facilities came into the area. Crystal Run is huge now. It's all over the county. It's in several counties. But I believe
But now
it
they're
got
a
its
big
start here.
corporation.
They're a
Now they're
huge
big
corporation.
corporations, and they've laid off some doctors. They've stopped some practices, and they're having billing issues, right? And they've even been investigated by the authorities, for bad business practices. I mean, listen,
When greed
we
runs your
all need
healthcare
health
system.
care. We all need health care. We all need our health care to work. This is what I meant when I was talking about government and keeping the water flowing into your house and keeping the sewers going. Like, there are things we take for granted, okay? And healthcare has been one of those things that we've all taken for granted because it's kind of always been there for us, right? Or not everybody, but I mean for a lot of people, and now it's devolved into a point where it doesn't work for anybody. It's not working for anybody except maybe if you're in that top tier. It doesn't work for anybody else. And it's not working for the doctors. You have less people going into the profession, right? It's not working. I mean, the insurance companies are sucking the life out of our healthcare system. And why people believe that like and worship the almighty insurance company is beyond me, right? Like, people should be saying, yeah, screw the insurance companies. I want my government healthcare, right? Those people on Medicare have it pretty good. I'd rather have that than this garbage over here, right? Like, I mean, use your freaking brain. I mean, like, I don't
Healthcare is
freaking
a
get
privilege. It's a privilege. It's a right. I mean, that's your tax dollars working for you. People don't understand. Like, oh, my taxes will go up. Yes, but your premiums will go down, and your copays, and your cost of medications.
Actually, that's the best part. It won't go down. It won't cost you a dime. Your taxes won't go up, right? Because here's the other side of it. If your company, which is paying $30,000 to $40,000 a year, right, for you to have health care, okay, and that money goes to the government to provide health care for everybody, not just you, right, you haven't lost a thing. You haven't lost a thing. In fact, I will guarantee you, I would guarantee money, all right, that you would actually get a raise out of it because the government wouldn't need as much money from your company that your company is currently paying for. Your company would be able to pay less to provide you health care through government, okay? And then you could take the rest of that money as an employee. Not that your employer would be like, hey, yo, I'm pocketing that money because that's what they do, right? But that would be an argument of there would be saving, your company would save money, therefore be able to either reinvest or give you more money in your paycheck or whatever, and you would still have your health care. And everybody would have health care at that point in time. And everybody would have the same health care. And then we can have the triage system. And then it would be Canada.
And guess what? It would increase jobs. There would be more. We'd be able to employ more healthcare workers and build more facilities and create more jobs, create more real good paying jobs, like radiologists and phlebotomists and nurses, not just and specialized doctors. We would be able to, we're going in the wrong direction. Why don't people understand that? Sometimes I just want, listen, MAGA, you deserve it. You deserve it. We deserve it. We deserve our tax dollars working for us. Why? Don't you understand?
Here's the thing. Here's even funnier part, right? These people think that these insurance companies, because they employ so many people, okay, if you got rid of these insurance companies, all these people would be unemployed, right? So I've heard that argument, right? Like, because the insurance companies employ so many people, and there are so many people employed because of the insurance companies. Every single one of those jobs is being replaced by AI right
Exactly.
now. Okay? So anybody who thinks, okay, that their job isn't about to be replaced by AI and about all this employment, it's gone. It's already
going.
gone. They already sold you out. Okay? So you have to now start thinking of the next job because that job is gone. Okay? They're replacing you with the AI and they're taking your money. Okay? And they're going to increase their profits as a result of it. Okay? And you got to remember something. $30 of every dollar right now that you pay into your private healthcare insurance goes towards profit and administration.
Wow. Yeah. Yep. I always said
Okay?
when it comes to cancer, cancer would be cured if it wasn't so profitable to treat. Because if
Everything,
you're
isn't it?
healthy, they can cure.
Isn't that everything?
Yeah. Yeah. It would be cured and then people would be healthy and we could get rid of
Uh,
that fucking thing. But no,
is it is
let's
it
keep treating it.
isn't the saying a patient cured is profit lost?
Oh, no, that's a new one. I never heard that one.
Oh yeah. Patient cured is profit lost.
But think about this with those jobs in insurance companies, those people have experience with healthcare and processing healthcare claims. There would still be jobs in the healthcare sector. Just taking your skills and moving them to the actual medical community. So it really isn't that bad when you think AI replacing those jobs bad enough.
AI's replacing is going to be replacing
I know.
jobs and filling jobs all over the place. The wealthy billionaires have been talking about this nonstop for the past year, and that's like all this nonsense is really gearing up toward that end, right? Like the idea of we want to replace people in more skilled positions with AI, right? And make people go back to doing the manual labor that the wealthy people, right, these billionaires don't want to do, but because they still need, right, they still want their shit. They don't really care about anybody else. They just want their shit. So like, and I think the healthcare thing is they're just trying to cull the herd.
Sadly, I think that's where
This
we are. Yeah.
idea, like they don't listen. They're billionaires. They don't need us anymore. Let's be honest. They don't need us anymore, right? At one point in time, they needed us for all the labor to make them money, but now they're gonna have AI making the money, so they don't
And
need us anymore.
robotics. Let's not forget,
Right. And
robotics.
they don't want to pay for social services and healthcare and all that kind of crap. So
And UBI.
right.
God forbid I bring that up, which is interesting because that's sort of the technocracy view that UBI would be needed. Universal income, monthly income or
Basic
something.
income. Oh yeah,
Basic
universal
income.
basic income. Milton Friedman.
Milton Friedman. Yes, Milton Friedman. We've mentioned him in the past.
Yeah, Milton Friedman. Universal basic income.
Yep, and that's sort of like
Republicans
their
will
crazy.
hate that. The fact that I linked that to him, but it wasn't his writings. So yeah.
Oh, that's that's very interesting.
Yeah, no, they hate that. They hated that. Listen. Everybody cherry picks what they want. They cherry picked out of
Yes.
Milton Friedman the trickle down economics part, right? But the other side of that was universal basic income, and right, and they were like, no, we don't want to talk about that. Let's leave that.
Yeah, we
out.
don't want to give the people anything. They need to pull
Right.
themselves up by they'll let them go get a job. Well, if all the jobs are being run by machines and computers by themselves, by the way, all of you people who are skilled using the AI, you're training them your career. You're training the AI to do your job. Think about that.
What's wrong with wanting to make the society better for everyone? For everyone, right? Like everyone. I mean, we fight wars all around the world. Everyone,
Right.
right? I think I think we could just make it better for everybody.
Yeah.
There was
I mean,
a
it's a
time
win-win
in this
situation.
country. There was a time in this country when we did strive for that. We had a really high upper. We used to have something like 50 something tax tax brackets, like,
My gosh.
yeah, I mean, like, it wasn't like it is today. Like, everybody, I mean, we have pretty much a flat tax today. I mean, as much as everybody, like, talks about whatever, right? It's almost a flat tax. I mean, you have, billionaire Warren Buffett has an effective tax rate of 13%, right? Most Americans have an effective tax rate of 22 to 25%. Okay, like, this false equivalency that we're all rowing in the same boat. Okay, it's not the case. And getting back, and that's exactly getting back to the healthcare. The point, we are not all in the same boat, right?
No,
We do not
no, we're
have all
not.
the same access and all the same things. Okay, and I think most people understand that and realize that, right? And I get that there are different views to try and fix that, but we have to start asking, what's our goal here, right? Because, if one group is saying, I want it fixed for me, but nobody else, what does that mean?
Yeah,
Who,
yeah,
what category are you in that differs from everybody else? Because I thought we were all Americans.
exactly.
So,
Exactly.
as far as I'm concerned, we're all the same.
And we all deserve the same
Right.
opportunity.
So, I again, play the tape out. I beg people to do that.
And by
Again,
that you mean look to the future. Look at what the
look at what
consequences
you're
are of what we do today.
and what you're saying and what people are advocating for and what they're saying. When you say, I don't want to pay for their health care. I don't want to pay for their energy, or I don't want to pay for who are they? Who are
Yeah,
they?
who are they? Exactly.
Like, I don't understand, like, that kind of talk. Who are you talking about?
By the way, if you have insurance and you're paying premiums, you're already doing that. Plus, you're paying for somebody's profit, a billionaire's profit margin as well, and their advertising budget and their legal budget to defend against when they cut people off their health care. You're paying for all that. And some portion of your premium hopefully goes to your health care if they don't deny it because they don't want to pay for it. So you're already paying for it. Why not put your tax dollars to work? Right now, our tax dollars are no longer working for us. They're working for the billionaires. They're stripping healthcare. They're stripping food assistance. They're stripping all of the things that made us safe. The CDC, food safety, the weather safety. All those things that made us safe. And our taxes, if you check that bill, you can go read it, it's online. Our taxes really aren't changing. If anything, they're going up, particularly for the lower classes. So we're paying more to get less from our government. And that is absolutely, that's a travesty. And we haven't started to feel it yet, but we're going to. And so
So
think about that.
we're gonna get regular updates on Denise's freckle,
Yes.
and she's gonna let us
Uh,
know what's going on with her health care related to that, especially as we start getting into the renewal phase of her ACA, and she has to go to exchange. So we'll keep everybody up to date on that as well. And again, if you're interested in sponsoring us,
we go back to that.
and helping Denise out, let us know, DM us.
Yeah, I might have to. You know what? I might have to start. Getting us monetized. So share, share, subscribe, get us
Right.
out there. Let your friends know. Let's get our message out there. I think today's message is we want universal health care. You hear that? That's what we want. We want to keep people. We want to keep America healthy. Everybody. I don't care who you are. All right. So take care of each other. And we love you guys, and we will see you soon. Take care.
Peace out.
Hey guys, if you're enjoying this episode, please let us know what you think in the comments. Also, if you haven't already, please remember to like, share, and subscribe. You can also click on that little bell so you get notified of new videos when they drop. And some good news, You can find us on popular socials, including Facebook, Instagram, TikTok, X, Twitch, and Patreon, with more to come. Just do a search for TOWTalk Podcast or the Town of Wallkill Podcast. So thanks so much for watching. We really appreciate you, and we look forward to delivering you more content in the future. See you soon, guys.